Let's talk about the best serum for brow growth. This is what you might get with Latisse applied once a day for 12 weeks. The active ingredient in Latisse is bimatoprost, a prostaglandin, which can increase the duration of the growing phase of the hair cycle. It does come with some possible risks, like irritation to the eyes because it's usually used for lash growth. That is less likely when putting it on the brows. It can cause the hairs to become darker, which you might want, but it also can cause hyperpigmentation of the surrounding skin. And periorbital fat loss is another potential concern. That, along with the hyperpigmentation, appear to be reversible upon stopping. What about insert your favorite brow serum? Many of these have isopropyl chlorprostonate, which is a prostaglandin analog that acts the same as bimatoprost. Meaning, yeah, it can work, but it also can come with the exact same side effects. What about a brow serum that doesn't have these ingredients? That probably just conditions the brow hairs, moisturizes them. Maybe it makes them look fuller, look thicker, but doesn't actually impact hair growth. Then you could also use 2% Minoxidil. After 12 weeks, this is about what it can get you. As I pointed out before, 2% Minoxidil in contrast to 5% Minoxidil for hair growth on your head is kind of underwhelming. Most people don't respond to it. But in the brow area, it might be a better choice. It appears to be effective and maybe less irritating compared to 5% Minoxidil, which if you've ever used can be irritating. Aside from the irritation, Minoxidil does not cause hyperpigmentation or periorbital fat loss. But if your pet licks your face, well, this can be harmful to pets, especially cats. Something I really want to emphasize here is that you need to know why it is your brows are thinning. Some people will just chalk it up to aging, but there are many hair loss conditions out there that can impact brow growth. This is lichen planopilaris or frontal fibrosing alopecia. It is a scarring type of hair loss. Once the eyebrow hair follicle has scarred down, you're not going to grow a hair out of it ever again. Early diagnosis and proper management, proper treatment for this are key for preserving both your hairline and your brows. But a lot of people will just copy and paste what other people do online for their brows, and they might miss out on a proper evaluation and correct diagnosis and proper treatment plan that in the long run could save their brows the most.